Well, good afternoon, everyone. Happy Wednesday. Welcome to today's COVID-19 update briefing. Today, I'm joined by Dr. Michael Lin, infectious disease specialist and hospital epidemiologist at Rush Hospital, who will provide some further insight into the dangers and health consequences of playing youth sports during the COVID-19 pandemic. I'll begin today by touching on that topic myself before we move on to today's regional metrics update and a few other items. We all want our kids to be able to play sports. We all want our kids attending in person at school. And we all wish that this pandemic were over. But unfortunately, until we're able to make that third wish come true, our ability to make progress on the first two is somewhat limited. As schools and school teams have come back together this month, many sports have made adjustments to keep kids safe so that they can play with a lower likelihood of transmitting the disease. Some sports, like youth football, are more difficult and offer a higher likelihood of transmission. Over the summer, we saw outbreaks across Illinois and the world tied to a variety of youth sports leagues. Those continue today, even among the lowest risk youth sports. We have watched professional sports and even some college teams play seemingly without many problems. But remember that these programs are operating with daily testing or in a league-created bubble or with facilities that allow for outsized social distancing and are sanitized every day. And in some cases, all of those precautions have been taken. That's not what's available to the vast majority of young people who play sports in Illinois. We've seen outbreaks here that have infected dozens of players, coaches, and family members, including one just last week in Wayne County, where nearly 100 players have been quarantined, and so far 37 have tested positive. Look, I'm not a scientist, but I do know how to listen to the experts and follow the latest data. I've always promised to do that, and I've always promised to be transparent about that, and I always will do that, no matter the political pressure. Under no circumstances will I put children and their families at risk. To those claiming that putting your child in danger is about personal choice, I say this is a pandemic. This is a terrible and unprecedented moment in our country. Living together in a free society means neighbors protecting each other so that we can all enjoy freedom and safety. This deadly virus should remind us that there are some individual choices that have enormous life-changing impact on others. While parents might choose to send their children out onto the playing field, I can tell you that someone else who becomes ill because of that decision wouldn't call that your personal choice. I want our kids back on the playing field or on the ice as much as anyone, and we'll get there when the doctors say it's safe. Until then, let's focus on keeping our schools and our businesses open and on keeping everyone safe. Let's be kind to one another, too. In a few moments, I'll ask Dr. Lin to speak further on this topic. So on to our regular update. Last week, I said that I was hopeful that Region 7, that's Will and Kankakee counties, might become a testament to a community's ability to turn their ship around. Well, I'm very happy to say my hopefulness hasn't been unwarranted. Yesterday, Region 7 brought its rolling 7-day average below 7.0 for the first time in weeks, and today that number sits at 6.4%. The first day below our 6.5% benchmark, indicating a reduced severity of community spread. IDPH will continue to watch that positivity over the next few days, and if that trend holds for 3 days, we will remove the resurgence mitigations and return the entire region to phase 4 of the Restore Illinois plan. Masks, distance, hand washing, enforcement, it all works. And Will and Kankakee counties are so far getting the job done, and we're all rooting for them. Over the last 2 weeks, nearly every region in the state has seen a stable or declining positivity rate. That includes Region 4, the Metro East region, which has been sitting above an 8% positivity rate since August 11th. Over these first 2 weeks of September, Region 4's rolling average dropped from 9.6% to 8.9% as of today. Let that downward movement be a testament to the fact that these doctor-recommended mitigations can work if they are followed. And I encourage residents of Metro East to call upon your local law enforcement and local public health officials to work together to help enforce the guidance and encourage masking and distancing so that that region can see even greater progress over the coming days and weeks. I want to turn your attention to other elements of our COVID-19 response, starting with our upcoming election. This morning, I sent a letter to the Illinois State Board of Elections regarding the two trends that we've seen emerge from this pandemic. One, a massive uptick in vote-by-mail requests as people continue to seek ways to reduce day-to-day risks in this pandemic. And two, a shortage of thousands of election judges, a position historically filled by older individuals who now are among the most at risk for COVID-19's worst impacts. To tackle these concerns and others, and to make sure that we conduct a safe, free, and fair election, I'm calling on the board to use $4 million in Help America Vote Act funds to develop an emergency grant program that will further subsidize and incentivize the use of drop boxes, will support local efforts to recruit election judges, and address other challenges confronting some of the county election officials across our state. Never before in our lifetimes have we faced an election amidst a pandemic of this scale. The Board of Elections directors shouldn't wake up the day after Election Day and wish that they had done more to strengthen our democracy and ensure our most fundamental right, the right to vote. I also want to provide an additional update on our state finances in this COVID-induced financial crisis. State and municipal budgets across the nation and here in Illinois are being decimated. And Republicans in Washington have so far decided that sending trillions of dollars to corporations is more important than providing support for public safety, human services, mental health, and senior care, among others. Today, I sent a letter to Illinois' congressional delegation outlining the potentially bleak picture for our schools, our firefighters, our law enforcement, our universities, our healthcare system, and all of our middle class, working class, and poor families if the Republicans don't work with the Democrats on behalf of our national economic recovery. In the letter, I reminded them that this isn't a problem unique to Illinois. I said, quote, "It's not a blue state problem or a red state problem. Texas is facing its biggest budget shortfall in history, and Florida's governor likened their budget situation to the red wedding scene in Game of Thrones. Similarly, cities and counties across America are facing massive service cuts that will have immediate effects on residents. As for Illinois, yesterday, as you know, I directed all agencies to prepare to cut operating budgets by 5% this fiscal year and potentially by 10% next year. Without help from Republicans in Washington, that translates directly into potential layoffs and a massive reduction of essential services for families across our state. That will deepen our economic recession and cause pain for all Americans. I asked President Trump and Republicans in Congress to act quickly to keep from deepening this already painful recession. Finally, it is in that same vein, keeping people on their feet and putting us all on the path to a faster recovery, that I will continue to work with leaders in the General Assembly as well as in Congress to advocate for more federal assistance to keep people in their homes. The need here in Illinois and across the nation is tremendous. Over 100,000 Illinois tenants and homeowners applied for our assistance program, but we only have enough funds to support approximately 40,000 of them. And ours is the largest pandemic housing stability program in the nation. It is for that reason that I'll be extending our eviction moratorium for an additional 30 days. Here in Illinois, we will use every legal tool at our disposal to keep people safe and healthy and employed and housed. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.